And for today's video, I will be showing you how to properly assess the abdomen of my patient. But before I start with that, allow me to give you an introduction to what equipments I am going to use. So first we have here a small pillow, a centimeter ruler, a stethoscope, a marking pen. So here I already give you a complete equipment that we are going to use later. So let's get started. Okay, so good afternoon, ma'am. My name is Ambrose Idolo from University of Eastern Philippines, and I'm your nurse student for today. So for verification, ma'am, may I know your name?
My name is Paulina Canto.
Okay, what about your birth date?
My birthday was on October 30, 2002.
Okay, so ma'am, which language do you prefer to use?
Tagalog and English.
Okay, so for today, ma'am, the purpose of assessing the abdomen is to provide a critical information about your internal organs and the key step in the evaluation of the abdominal complaints. So, ma'am, I am going to ask you some questions. So, ma'am, is that okay with you?
Yes, of course.
Okay, so first, do you have any abdominal pain present?
Wala naman so far.
Okay. What about factors that precipitate the pain or make it worse?
Wala naman.
Okay, that's good to know. What about the other symptoms present, such as a nausea, vomiting, diarrhea, appetite changes?
Wala naman akong diarrhea or any problems na.
What about constipation?
Wala naman.
Okay, that's good to know. What about in recent weight?
Nag-gain po.
Okay. What about in past history? Do you have a previous abdominal surgery?
Wala naman.
Nagka-trauma ka na ba? Any medications? Okay. What about in previous abdominal pain and treatment?
Wala pa naman.
Okay. So do you have any result in lab work or gastrointestinal studies?
Wala naman.
Okay. What about in family history? Is your family mom, do you have a stomach or a colon or liver cancer?
Sa pamilya namin, wala naman.
Okay. What about in having an abdominal pain, such as appendicitis, colitis, or bleeding?
Wala naman.
Abdominal. Okay. What about in person responsible for nutrition in family?
My mother.
Okay. What about in lifestyle and health practices? Do you smoke?
Never.
Okay. What about drinking and alcohol?
Never.
Okay. So nagda-diet po ba kayo?
Paminsan-minsan.
So do you use a antacid?
Hindi pa.
Okay, so ma'am, nag-exercise ka po ba?
Hindi.
Okay, so do you use any medication?
Yung ano lang, for some food supplements.
Fluid intake po ma'am.
Mga 6 glasses.
6 glasses. What about in cause and stress in life? Do you have an effect on eating or elimination pattern?
Yung school works.
Schoolwork. What about, do you have a past action with abdominal pain or nagka-problema na kayo po ba?
Wala.
Okay. Okay, so ma'am, I am going to start assessing you, and I do need you, your full cooperation. So is it okay with you?
Yes, of course.
Okay, that's good to know. So I am going to sanitize my hand first. So I'm going to place it here, and I'm going to sanitize. And I am going to close the curtains to provide you a privacy. Okay. So ma'am, first I am going to inspect your skin, and I'm going to note your color, the vascularity, scars and lesions. So first I am going to do a supine position. So can you please do a supine position? Okay, so I'm going to open your abdomen. So now I am going to inspect your skin for there is any scars. Okay. So ma'am, your skins are all good, and your stretch mark is pink or blush in color, and your skin is bit paler, and your skin is free from lesions, masses, or rashes. So next, I am going to inspect your umbilicus. So I am going to noting for the color, the location, and the contour. Okay. Okay, so I observe that your umbilicus, ma'am, is even or pink in color, and it is in the midline and recessed, and that goods here. So third, ma'am, I am going to inspect for your contour of the abdomen. Okay. Okay, so I observe that your abdomen is flat and evenly rounded. So next, I am going to inspect for the symmetry of your abdomen. Okay. Okay, so I observe that your abdomen is symmetric and it's normal. So next, I am going also to inspect your abdominal movement and noting for the respiratory movements, such in aortic pulsations and or for the peristaltic waves. So, okay. Okay, so you observe that your abdomen is quite visible. So next, I am going to auscultate for the vowel sound. Okay, so using my stethoscope, I am going to auscultate. So using the bell. Okay, so I have heard, ma'am, that there is a presence of soft clicks and gargles, and it is normal to hear. So next, I am going to auscultate for the vascular sound and friction rub. Okay. Okay, so I do not hear any abnormal sounds like brutes. So your abdomen, ma'am, is all good. So next, I am going to percuss the abdomen for the tone. Okay, so you have heard the dullness, so in your abdomen, so nothing to worry, ma'am. So next, I am going to percuss your reefer. So, so I am going to mark here the. Okay, so ma'am, the liver dullness is presented as I percussed it. So I marked it here because there is a dullness on your abdomen. So next, I am going to percuss your spleen. So, okay, so there is an oval area of the dullness presented and it is okay. So next, I am going to perform a blunt percussion on your liver and the kidneys. So can you please sit in position? Okay, so normally po ma'am, there is no tenderness elicited. So next, I am going to perform a light palpation. So I am going to note for the tenderness or guarding, in all quadrants. So okay po ma'am, so far naman your abdomen nyo is non-tender and it is soft and there is no guarding. So next, I am going to perform the deep palpation and I am going to note for the tenderness or masses in all quadrants. So okay, so ma'am, it is normal for your tenderness and it is palpable and the abdomen, and that is good to know. And I observe that there is no palpable masses included. So next, I am going to palpate the umbilicus. So okay, so your umbilicus are free of the swelling, the bulges, or the masses. Okay, so next ma'am, I am going to palpate your aorta. Okay, so your aorta ma'am has a regular pulse and mild tenderness, and it is maybe inelicited. So next, I am going to palpate your liver. I am going to note for the consistency and for the tenderness. So okay, so ma'am, your liver is not palpable. So also it is smooth and even. So next, I am going to palpate the spleen. So I am going to note for the consistency and for the tenderness. Okay, so ma'am, your spleen is soft and non-tender as the edge of the spleen, and it can palpate. So next, I am going to palpate your kidney. Okay, so based on my findings, ma'am, your kidney are slightly tender and it is not palpable. So it is normal naman po. So next, I am going to palpate your urinary bladder. Okay, so your urinary bladder, ma'am, is not palpable and it is tender. So next, I am going to perform the test for the shifting of the dullness. So,
Okay, so can you please do a side lying position, ma'am?
Okay, so can you please? Okay, so ma'am, your tympani and dullness remain constant naman po ma'am, and throughout your position changes, it is normal naman po. So next, I am going to perform the fluid wave test. So,
Yes, can you do this, ma'am? Okay.
so far ma'am, your there is no fluid wave transmitted. So okay, now I am going to perform the balutamine test. So, okay, so ma'am, I've seen that the increased patella waving motion or spongy type in you po, and it is normal naman so far. So next, I am going to perform the tests for the appendicitis. So the rebound tenderness, the reversing sign, the referred rebound tenderness, also the SOSA sign, the obturator sign, and the hypersensitivity test.
Okay, so ma'am, can you do a side lying? Okay, so I'm going to bend your Okay, can you please do a supine position? Okay, so I am going to bend it here. Okay.
Okay, so far ma'am, there is no pain present in your abdomen, no pain in exaggerated sensation feels. Also, there is no sin in you naman, and that good to know. So lastly, I am going to perform the test for the cholecystitis. Okay, so exhale. Okay, so I observe ma'am that there is no increase of pain seen in as doing a Murphy sign test. So lastly, I'm going to cut your hands. I'm going to wash my hands. Okay. So next, I am going to record all the things. Okay, so last, I am going to formulate a diagnosis. So a nursing diagnosis analyzes the patient's needs. So first and foremost, we have to collect and analyze the data. Also, we have to observe the patient's symptoms. We have to talk to the patients and their loved ones about their feeling. We have to evaluate the patient's response to their symptoms. We have to distinguish between the objective and the subjective data. And then we have to identify the problems that your nursing diagnosis will address. So here I am going to be the patient's referral firm. So today's date is June 24, 2022. Okay, so we have here the referring patient information. So my patient's name is Miss Pauline Acanto. Okay, so her date of birth is on April. Okay. Also, it is including the address and the contact numbers, which is confidential, and the preferred contact name of the name of her mother is Chloe Acanto. Okay, so here the reason for referral. So Miss Pauline Acanto was referred for the abdomen assessment performed by the nurse, me, Emerose Dolo to evaluate and observe if there are any problems, abnormalities, or conditions, information that timely insight into the health record of Miss Pauline Acanto, and that can point out to some early symptoms or identify the certain condition that may require early attention. Hence, the assigned nurse would be better understand about Miss Pauline Acanto overall evaluation. So here is the actual diagnosis. So my client said that she has a no abdominal pain present in her. Therefore, I can ask her the factors related to it and its location. Also, my client said that she didn't feel other symptoms present, such as a nausea, vomiting, diarrhea, also a appetite changing, and constipation. So in the risk factors that my client, she has no a previous abnormal surgery like trauma, injury, medications. Also, my client said that she said that she don't have any result of any lab work or gastrointestinal studies. Also, she said that she has no family history of having a stomach, such as colon or liver cancer. Also, my client said that she don't have any history of abdominal pain, appendicitis, cholestasis, bleeding, or hemorrhoids. Also, she said that a person responsible for her nutrition family is her mother. Okay, in wellness, my client said that she never smoke and drink any alcohol. She said that she only eat healthy foods. Also, my client stated that she never used any antacid nor medication. Also, my client has a readiness to stay healthy by taking vitamins. Also, my client said that she drinks 6 glasses of water. Also, my client said that she said that one of the causes of her stress in life, school, or works, and that may affect on eating and elimination pattern is that she eats small amount of food at night. Also, my client said that she don't notice any fast action with abdominal pain or any problems. Okay. So in second part, in identifying related factors. So first, we have to find the source of the patient's problem. Next, we have to evaluate the patient's history and overall health. Third, we have to include the potential problems when determining the related factors. So here is the patient's mother, Mrs. Kimi Acanto. So good afternoon, ma'am.
Good afternoon.
Okay, so I am going to ask you some questions. So is it true that your daughter has no previous abdominal surgery, such as surgery, ma'am? Okay. Well, is it true that she has no previous abdominal pain or any treatment?
A lot.
Okay. Is it true that your daughter said she don't have result of any lab work or any gastrointestinal studies?
A lot.
Okay. Is it true that she don't have a family history of having abdominal pain?
Yes, it's true.
Okay. Is it true, ma'am, that okay, so is it true, ma'am, that you are the person responsible for the nutrition of your family?
Yes.
Okay. So that's all, ma'am. Thank you.
Thank you.
Okay, so in third part, in making a diagnosis is making a clinical judgment. So in the first step is we have to find the appropriate nursing diagnosis. Next, we have to combine the related factors of the diagnosis. Next, we have to summarize the data. And now I am going to check the objective my patient. So my patient's skin are all goods, and my client's stretch mark or stray mark is pink or blush in color as a skin with a pallor, and her skin is free from lesion, masses, or rashes. Also, my client's umbilicus is even or pink in color. It is in the midline and recessed. Also, I observed that my client's abdomen is flat, evenly rounded, and symmetric. Also, her abdomen is quite visible. Also, there is no presence of soft clicks and gargles and my client's bowel sounds. Also, I do not hear any abdominal sounds like roots, during the auscultation of the vascular sound of my patient. Also, I heard a dullness in my client's abdomen for the tone. Also, the liver, the dullness is presented as I discussed it. Also, I observed that there's an oval area of the dullness presented in my clients. Also, there is no tenderness elicited in her kidneys and liver. Also, the abdomen is not tender and it is soft and there is no gardening. Also, it is normal tenderness is palpable in the abdomen of my client. Also, I observed that there is no palpable masses included. Also, I observed that my client's umbilicus are free for swelling, bulges, or masses. Also, her aorta has a regular pulse and mild tenderness may be elicited. Also, my client's liver is not palpable. Also, it is smooth and even. So, based on my findings, her kidneys is likely tender and not palpable. Also, my client urinary bladder is not palpable and tender. Also, my client tympani and dullness remain constant throughout the position changes. Also, I observed that there is no fluid wave transmitted. So, I have seen an increased patella, waving motion, or spongy type in her. Also, there is no present any pain present in my client's abdomen, no pain of any exaggerated sensation feels that is seen her. So I observed that there is no increase of pain seen in my client as do the Murphy sign test. So last referred by nurse me, Emmy Rose Dolo. Also include the signature, which is important. Also the address and contact number, which is confidential. Okay. So I am done assessing the abdomen. So thank you, and that's all.